Principles of human growth and development. The term growth and development both refers to dynamic process. Often used interchangeably, these terms have different meanings. Growth and development are interdependent, interrelated process. Growth generally takes place during the first 20 years of life, development continues after that. Growth is physical change and increase in size. It can be measured quantitatively. Indicators of growth includes height, weight, bone size, and dentition. Growth rates vary during different stages of growth and development. The growth rate is rapid during the prenatal, neonatal, infancy and adolescent stages and slows during childhood. Physical growth is minimal during adulthood. Development is an increase in the complexity of function and skill progression. It is the capacity and skill of a person to adapt to the environment. Development is the behavioral aspect of growth. Development. Development, synonymous with maturation, used to indicate an increase in skills or the ability to function, qualitative change. Can be measured by the FF. Observing child's ability to perform specific task. By recording the parent's description of child's progress. By using standardized tests such as Denver 2. Denver 2 test, Denver Developmental Screening Test 2, 125 easily administered developmental test items, with age norm, presented in a convenient one-page format. Principles of growth and development. Growth and development are continuous process from conception until death. Growth and development proceed in an orderly sequence. Different children pass through the predictable stages at different rates. All body systems do not develop at the same rate. Development is cephalocaudal. Development proceeds from proximal to distal body parts. Development proceeds from gross to refined skills. There is an optimum time for initiation of experiences or learning. Neonatal reflexes must be lost before development can proceed. A great deal of skill and behavior is learned by practice. Types of development. Psychosexual development. Specific type of development that refers to developing instinct or sensual pleasure. Psychosocial development. Refers to stages of personality development, Erikson. Moral development. Is the ability to know right from wrong and to apply this to real-life situation, Kohlberg. 4. Cognitive development. Refers to the ability to learn or understand from experience, to acquire and retain knowledge, to respond to new situation, to solve problem. Measured by intelligence tests, and by observing a child's ability to function effectively in his/her environment. Freud's psychosexual development theory. Erikson's stages of psychosocial development theory. Havighurst's developmental stage and tasks. Levinson's seasons of adulthood. Sullivan's interpersonal model of personality development. Piaget's phases of cognitive development. Kohlberg's stages of moral development. Gilligan's theory of moral development. Fowler's stages of faith. Physiologic and structural changes. Respiratory rate and pulse rate decrease sharply during the first 2 years and then more gradually throughout childhood. Blood pressure rises steadily beginning at approximately 6 years of age. Development of the paranasal sinuses continues throughout childhood. The ethmoid, maxillary, and sphenoid sinuses are present from birth. The ethmoid reaches its maximum size relatively early in childhood, 7 to 14 years of age. Others reach their maximum size after puberty. Lymphoid tissues develop rapidly, reaching adult size by 6 years of age and continue to hypertrophy throughout childhood and early adolescence before receding to adult size. The metabolism of medication and child's response to them change rapidly in the first month of life and again under the hormonal influences in puberty. Nutritional needs as well as a wide variety of biochemical and hematologic values undergo marked developmental changes. Developmental stages. Importance of knowledge of growth and development. 1. Health promotion and illness prevention. 2. Health restoration and maintenance. Factors that affect growth and development. Genetics, environment,